Good day everyone, we are from Group 6 and we would like to draw your attention to our breaking news today. Children fell ill after visit to bird sanctuary, and the culprit is West Nile virus. There were a total of 3 schoolgirls fell ill with similar symptoms such as persistent high-grade fever, joint pain, convulsion, headache, and lethargy 3 days after a school trip to bird sanctuary in Perak. Blood and CSF were negative for bacteria, fungus, parasite, and dengue virus. Investigation was done at the housing area, school, bird sanctuary, and recreational forest that they stopped by during their trip. Larvae of keyless mosquito were found in the stagnant water of bird sanctuary. Disease transmitted by keyless mosquito was suspected. Hence, Japanese encephalitis virus and West Nile virus were tested. Result came out that they were negative for JE virus, but positive for West Nile virus. According to the Department of Wildlife and National Parks, an increased mortality among the migratory birds was noticed during their routine sampling. Clinical signs observed include incoordination, unable to stand, and prostrate to the ground. Birds were tested negative to Newcastle disease and avian influenza, but they were positive to West Nile virus. Hence, the migratory bird could be the source of transmission of West Nile virus. West Nile virus is a single-stranded RNA virus. It is under the family of Flaviviridae, genus of Flavivirus. Moving on to the epidemiological triad. West Nile virus is a flavivirus which can survive outside viable hosts. For example, they can survive in dry blood and exudate for up to several days at room temperature. This virus is also able to evade innate immune system of the host. Environmental factor is also a big contributor to this disease. This disease is known to transmitted by the vector of keyless mosquito. Hence, area with high keyless mosquito prevalence has greater risk. Rainy season and geographical distribution, such as palm, rubber, paddy field plantation, provide an ideal breeding environment for mosquito too. During the migration period of wild birds, West Nile disease could be spread by the wild birds. The primary host for West Nile virus is the birds, while the dead-end host is humans or equine. Dead-end host means that although they were infected, but the virus does not replicate at high level in their body. Hence, the mosquitoes are less likely to acquire enough virus from the infected human or horses. The predisposing factor of the host to this disease are immunosuppression, pediatric and geriatric patients, and also patients with underlying debilitating disease.
Next, we'll move on to clinical signs of birds infected with West Nile virus. Infected birds can exhibit neurological signs such as head tilt, tremors, blindness, ataxia, nystagmus, hind limb paralysis, and seizures. There are also non-specific signs such as dehydration, feather loss, weakness, recumbency, anorexia, and lethargy.
West Nile virus is most commonly spread by the bite of an infected mosquito. In other cases, West Nile virus may have been spread through the blood transfusion and also organ transplantation. From cases mother to the baby, pregnancy, delivery, or breastfeeding may also be a potential transmission route for West Nile virus.
Next, the public health significance. West Nile virus is a vector-borne disease that is often neglected in Malaysia. The zoonotic transmission to human is via the bites from the infected keyless mosquitoes. While for the risk factors, it included the older age, individual with concurrent disease, and immunosuppression. For the mild infection, we can see fever and flu-like symptoms, while for the severe infection, it could be meningitis and encephalitis which will be showing the neurological signs. In fact, 1 out of 150 infected people will develop severe and fatal infection.
Moving on to the diagnosis of West Nile virus infection. Firstly, history taking can be done, and some questions that may be asked are the patient's travel history in areas with known of West Nile virus exposure. Besides, potential mosquito bites and clinical signs also give clue to the clinician when making a diagnosis. Second, Serological tests need to be done to detect antibodies against West Nile virus, and the tests include ELISA, hemagglutination inhibition test or HIT, and immunofluorescence assay IFA. Samples that can be used are serum as well as cerebrospinal fluid. And lastly, PCR can be done to detect the viral RNA.
Fortunately, there's no specific treatment to treat the West Nile virus disease. So the treatment is generally supportive and it aims to relieve symptoms, for example, fever. Moving on to the last part of this presentation, which is the prevention and control of West Nile virus disease. So currently, unfortunately, there's no developed vaccine yet which is available to prevent the West Nile virus infection. So the only and primary prevention measure is to protect the human and the animals from mosquito bites, as this disease is mainly transmitted through mosquito bites. So here are a few of the strategies that can be implemented. First one is by using the insect repellent. So here are the few examples of insect repellent that can be used, such as DEET, picaridin, IR3535, and so on. For the second method is to wear long sleeve shirts and pants to prevent bites from the mosquito, and to treat the clothing and gear with 0.5% of insecticide, which is the permethrin cream. And lastly is to implement mosquito control measures in terms of indoor and outdoor. Inspection of the indoor and outdoor containers for stagnant water can be implemented, as these are the ideal spot for the mosquito breeding. Well, lastly is to install the screens on the windows and the doors of any buildings and so on. And here are the end of our presentation. Thank you.